20 years old man is admitted to intensive care unit with isolated severe head injury, and CT scan shows multiple intracerebral bleed but no midline shifting. He is intubated and ventilated. His pupils is dilated and reacts sluggishly to the light. His heart rate is 50 beats per minute, blood pressure 110 over 170 over 110 millimeter of mercury, respiratory rate 10 breaths per minute. The rising blood pressure is likely to be caused by, that means their blood pressure 170 over 110. So what is the cause of increased blood pressure in this patient? So the patient is suffering from the road traffic accident severe, and there is severe head injury and multiple bleeding occurs. So when there is multiple bleeding spot present within the brain, first of all the intracerebral pressure or ICP it will increase. When the intracerebral pressure it increases, it causes sympathetic stimulation. Where there is the sympathetic stimulation, there is increased blood pressure. When there is increased blood pressure, this increased blood pressure causes firing of the baroreceptor, which is situated in the internal carotid artery or common carotid artery and arch of the aorta, and when fires the baroreceptor, then heart rate reduce. So it is a normal mechanism of the head injury. In case of head injury, first of all the ICP, which is increased, that means the intracranial pressure increase. When intracranial pressure increase, then sympathetic nervous system is stimulated. For this condition, blood pressure increases. When blood pressure increases, this increased blood pressure fires the baroreceptor, and when this fires baroreceptor, then heart rate reduce. So what will be the option? Here the options are the aortic and carotid baroreceptor stimulation, cortisol stimulation, renin angiotensin stimulation, sympathetic stimulation related to blood loss, sympathetic stimulation related to increase intracranial pressure. So first of all, let's see a triad, which is the Cushing triad, and this Cushing triad developed due to head injury, and in this condition the primary event is the increased blood pressure, which is the hypertension, then bradycardia, then irregular respiration. This triad is known as the Cushing triad. It occurs in case of the head injury. So let's see, when intracranial pressure exceeds mean arterial pressure, that means intracranial pressure it exceeds its normal limit, then compression of the cerebral arterioles result in cerebral ischemia, and in this condition sympathetic nervous system is stimulated initially. So when there is a head injury, initially sympathetic nervous system stimulation occurs, and the sympathetic nervous system it acts on the peripheral vascular system and increase its resistance, and finally there is development of the hypertension. On the other hand, the cardiac output is also increased as there is increased blood pressure. These hemodynamic changes is detected by the baroreceptor. This baroreceptor situated in the aortic arch and also the carotid artery, and which stimulate the parasympathetic nervous system. And this parasympathetic nervous system, what causes? It causes reduction of the heart rate. So first of all, blood pressure increase due to sympathetic stimulation, then parasympathetic stimulation it reduces the heart rate. So what is the cause of rising blood pressure of 170 over 110? It is caused by sympathetic stimulation. This portion is true but not related to blood loss. It is related to the increased intracranial pressure.